The small crowd of men that formed on the Dallas side of the bridge parted to make way for a blue roadster which raced the length of the bridge to where I was standing. It executed a 180-degree turn on the middle of the bridge and came to a halt. The roadster's highly polished blue door swung open, and out of it stepped a man wearing fancy cowboy clothes. He came across the bridge and took up a position on the sidewalk by the bridge railing about 10 feet in front of me. "Do you know who I am?" he asked. "No," I responded. "Why, I'm Tom Mix," he said. "You don't look like Tom Mix to me," I said, "and I go to all his pictures. I love his horse Tony." The man seemed pleased with my statement. "There is another Tom Mix, but I'm the real one," he responded. "Your face looks thinner than the face of the Tom Mix I've seen in the pictures," I told him. "Well, I've been in the hospital, but they released me so I could do this job," he volunteered. "You see, I'm going to shoot you one way or the other." That's again James Shelby Downard's The Carnivals of Life and Death. Hello and welcome to another edition of the Stench of Truth. I have one focus for this issue, and that is the issue of pain management. Pain management is a healthcare failure in this country. And the reason it has become a healthcare failure is because we have at our disposal adequate means of alleviating pain for people who have chronic and acute pain management issues. I know several people in my life who suffer with fucking chronic pain. Chronic, severe pain. And they cannot get relief for their pain with medication that is readily fucking available because there are several factors at work in this. One is doctors are fucking afraid to give adequate dosage of medication to their patients because they fear that people are going to become addicted to the painkillers. Or two, they have to fill out too much fucking paperwork to make sure that everybody is fucking satisfied. If they want to give a prescription of oxycodone or Percocet or some other strong opioid pain reliever. And it's bullshit. It's fucking bullshit. And you know, I see this every day with people I know. People who suffer from chronic fucking pain, who cannot go to their doctor and get medication that would alleviate that pain. How many fucking days are lost on the job to insufficient, inadequate pain management? This is a huge fucking problem in this country. There is medication that is readily available. The first and foremost duty of any fucking doctor should be for the help of his fucking patient. And if they're suffering from chronic fucking pain, they should be able to get medication that will alleviate that. But they don't. Because there are too many fucking restrictions and because people are afraid of addiction, of abuse, of all these other problems. That should not be a concern for a medical professional. Not in the first instance. The first instance when you are a medical practitioner is for the care of your patient. And if your patient is suffering from chronic pain, you should give them the medication that they need in order to control that pain and manage their lives. If a problem develops down the road, then by all means address it as you should as a medical provider. But do not sit back out of fucking fear or out of laziness to fill out fucking forms. Do not fail in that first fucking instance when that patient comes to you and is looking for help. Do not turn them away as so many fucking doctors are doing today. I'm just sick of it, because this is a serious fucking healthcare problem in this country. It's one that is not being addressed, and it's one that absolutely must be addressed. I see it every day, and I'm sure every one of you know at least one person who can't get the fucking medication they need in order to alleviate pain that they have to live with every fucking day. That is a medical fucking travesty in this country. Allowing people purposely to fucking suffer because you either don't want to get involved with filling out forms, or because you're worried about something that might fucking happen down the road. It's bullshit. Thank you. Good night.